All right, everybody, welcome to our first Program Integrity webinar of fiscal year 2022. So hard to believe that calendar year 2022 is right around the corner. Today's webinar will focus on improper payments, specifically investigations and recovery. Hopefully, many of you know CCDF regulation does require lead agencies to investigate and recover fraudulent payments. But in addition to fraud and intentional program violations, today's webinar is going to dig into strategies related to recovery of unintentional provider and participant errors and agency errors. So we're going to cover the whole gamut of improper payment errors. Just a little bit of housekeeping before we jump into the content. We do encourage interaction throughout the webinar. That's also kind of one of the reasons we open up the room early, allow you all to interact with each other. Feel free to continue to use that chat pod to ask questions and to share information. We will take frequent breaks to address any questions that might come in and also to discuss some of the more pressing topics that might come up this afternoon. Due to the large number of attendees that we have today, and thank you all for your interest in our content. All attendees' microphones have been muted, but again, please use those chat boxes to interact with your peers and our presenters. In the Program Integrity Resources pod, you'll see that in the lower right of your screen. There are some relevant resources available for download, as well as the handout of today's slides. So please feel free to download resources as you wish. And finally, for any connection issues that you might have today, please reach out to Heidi Freimiller. She'll be your contact if anyone has issues. The National Center on Subsidy Innovation and Accountability has a team of dedicated program integrity and fiscal subject matter experts. This group here has over 65 years of combined program integrity experience, and we love sharing our knowledge with all of you. I'll also say that with each of these webinars that we do, we are learning from all of you as well. That's me on the left, Leanne Bryan. I'm calling in from just outside of Harrisburg, Pennsylvania. Shannon Massarocco is from Rhode Island and our fiscal management, financial accountability subject matter expert. Janae Williams is joining us from Louisiana, and Mike McKenzie from Wisconsin. Mike and Janae are our dynamic PI-SME duo. Now for a welcome message from the Office of Child Care. I'm going to turn it over to the Director of the Division of Oversight and Accountability, Toya Bryant. Toya?
Thank you, Leanne, and good afternoon, everyone. As Leanne just shared, my name is Toya Bryant, and I'm so happy to be with you this afternoon, and I'm joined today by two of our division team members, Linda Winings and Adi Fatur, and we would like to welcome you on behalf of OCC to the first webinar of the 2022 National Program Integrity Webinar Series. As Leanne has shared, that today our focus is going to be on improper payments and recovery. And we are so very excited to welcome the Kansas Department for Children and Families to learn about their strategies for identifying, investigating, and recovering improper payments. These webinars are a part of OCC's ongoing work to support states, territories, and tribes to strengthen their program integrity and accountability efforts and to minimize the risks of waste, fraud, and abuse. And so we are, again, looking forward to hearing from Kansas and to hear about how the work is being implemented on the ground. These webinars are a great opportunity for you to hear from peers and to learn about the work that's being implemented in states. And we want to thank the states who have participated on these webinars and encourage you to reach out to us if you have practices or strategies you would like to share. We value the ongoing participation we have had from the field and use your feedback to help us select topics for these webinars and other TA materials. So please continue to share your ideas about what you would like to see in the future. And so now I would like to turn it back over to Leanne to review the agenda and get us started.
Thank you, Toya. All right, here's our agenda for our time together today. We're going to start with an overview of improper payments and recovery. We're going to get into the different improper payment types, what's required in regulation, and the benefits of recovering improper payments. The team will walk through strategies related to provider, participant, and agency improper payments. As Toya mentioned, we are very pleased to have Melissa Vo from the Kansas Department for Children and Families sharing with us today. Melissa will highlight their program strategies and results specific to investigation and recovery of improper payments. And we'll wrap up today with any final questions, a save the date for the next webinar, and closing remarks. With that, I am going to turn it over to Janae. Thanks, everybody.
Right, awesome. Thanks, Leanne. Sorry, I have a bit of a cold, so sorry, you guys. In this section, what we will discuss at a high level is the definition of improper payment, the types of improper payments, the recovery of improper payments, and the benefits of recovering improper payments. So this is at a high level, and it will just be an overview to kind of set the stage for the rest of the presenters. So let's begin with the definition of an improper payment. So at a high level, CCDF regulatory language at 45 CFR 98-100 D1 and 2 at a high level indicates that an improper payment is a payment that should not have been made, or a payment that was made for the incorrect amount, which includes payments for ineligible services, payments made on behalf of ineligible participants, duplicate payments, and payments for services not received. This includes overpayments and underpayments. Now, however, throughout this webinar, we will be discussing overpayments. So let's look at the types of improper payments. Now, for purposes of this webinar, we have grouped improper payments into 4 types: fraud, intentional program violation, unintentional program violation, and an agency error. The lead agencies have flexibility in defining these types, but we wanted to provide some examples of each to give agencies an idea of what the definitions may look like. Now, while I won't read each of these to you, you'll notice that in each of our definitions, the verbiage improper payment is included. These definitions provided were kept broad, so feel free to review these at your leisure. As Leanne stated, the webinar handout is available for download in the Program Integrity Resources pod below. Now, as we go through the rest of this presentation, my colleagues will also provide examples of the types of improper payments at 3 levels: the participant, provider, and agency. So now let's talk about the recovery of improper payment and what is required. So in CCDF regulations, states should have a plan in place to investigate and recover fraudulent payments, right? In addition, those fraudulent payments shall be recovered from the person responsible for committing fraud. Now let's take a deeper dive into federal and state disallowances and recovery activities. Now, while states are required to recover CCDF payments that are a result of fraud, lead agencies have discretion as to whether to recover misspent funds that were not a result of fraud, such as improper payments that are a result of an administrative or agency error. And at the federal level, the ACF, any overpayment or expenditures not made in accordance with the CCDF regulations that are identified in audit are subject to state disallowances, and disallowances may be recovered via offset or repayment. Now let's take a look at the CCDF improper payment results for the past 5 years. All right. So just as states are asked to provide results in the state plan, HHS provides CCDF payment integrity results to the public as part of their accountability activity. The screen shows the payment integrity results for the last 5 years across agencies. Lead agencies report these improper payments as part of their error rate review process. Now, CCDF has been categorized as a high priority or high risk program because of the monetary loss of over $100 million annually. High priority and high risk programs are designated by the Office of Management and Budget, or OMB, and the agency. Monetary loss to the government includes amounts that should not have been paid and in theory should be or could be recovered. The amounts on your screen do not include fraud or program violations. So let's look at the columns. The amount in the dark blue column represents the improper underpayment as a result of eligibility decisions. The amounts in the tan column represent known eligibility errors of lead agencies and other parties that determine eligibility on behalf of the lead agency, such as contracted organizations or other organizations that administer the federal dollars. And the final blue column represents unknown or mid, which we also know as missing or insufficient documentation, improper payments. Now, we encourage agencies to review the HHS Agency Financial Report, or AFR, located on the website at the bottom of the slide to get a full understanding of the fiscal impact of improper payments. Now let's talk about recovery benefits. Throughout the rest of this webinar, we will discuss the benefits of recovering CCDF funds, but to get us started, here are a few recovery benefits from an agency standpoint. One, the agency builds public trust by showing they're effective stewards of taxpayer dollars. Two, they assure benefits are going to the right individuals. In addition, three, they save monetary resources to open up new opportunities. In each of the upcoming sections, we will provide additional improper payment and recovery benefits. But for now, let's stop here and see if there are any questions. So we have OCC on the line and can use about 2 minutes to answer questions as it relates to the overview of information just provided. Full disclaimer, policy questions may need to go to policy, and in that case, we will work with the regional offices to get those responses back. We'll give it about 2 minutes here, and I see that we have someone typing in the chat box. That may be a doozy, too. We'll give it a few more here. So I have Amber Mavis asked, did I hear correctly that states do have the flexibility in deciding whether or not they collect improper payments that are not a result of fraud? That is correct, Amber, and I will turn the floor over to OCC to elaborate.
Yeah, I think Janae just gave you the correct answer, that yes, you are required to recover fraud, but states have flexibility about recovery of other dollars. However, as you probably noted on the previous slide, in the case of an audit, you could have funds disallowed if it was determined to be misspent in an audit, in a single audit or OIG audit or other type. So that's just something to consider. And if you do recover funds that were misspent, if it's within the appropriate liquidation period, you may be able to reinvest that money. And I know that that's going to be discussed a little bit later in the presentation. So that's just another thing to consider. But yes, you do have flexibility in that area. Thanks.
Thank you, Linda. And here's another question from Colin McDonald. So improper payments that are not fraud-based are still considered not allowable then?
This is Leanne. Colin, I'm not sure I'm following your question.
If I understand, okay, so you shouldn't, I can't see it. So you couldn't charge them to the award. So I think what he's asking, are you asking about payments or money that was spent against CCDF regulations, Colin? Or regulatory requirements? Essentially non-fraud improper payments.
If that's, yeah, I think I'm understanding the question. Yeah, I mean, there is a difference between a fraud, some fraud, things were actually spent on fraud, which we call intentional program violations. Those you are required to recover. The others, there is flexibility. I guess what I was just pointing out is that if dollars are allocated and your agency has determined that this is how you're going to spend it, and then it is spent not in compliance with CCDF, then in the case of an audit, an auditor could look at those funds and say, you know, these dollars were misspent, and therefore they could be disallowed and they could require them to be recovered, or I'm sorry, to be repaid to the federal government. However, if you recover them within a certain time period, and it depends on the dollars on the funding stream and of the time period that you're working in, it may be possible. And it also depends on whether or not you're able to, you know, you should be able to track those dollars and know what funding stream they came from and what time period. If you're able to do that, then you may be able to, reuse that. You may be able to recover those dollars and then use them for allowable costs. So that's kind of something to aim for if you do have money that is spent that way, money that is considered misspent. So we're just kind of drawing the line between fraud and intentional program violations and unintentional program violations, or the dollars that you might see in the improper payment error rate review. Those dollars are not fraud. Those are just improper eligibility payments. Maybe an error in an accidental mistake made during eligibility, not fraud.
Awesome. All right, so we have another question, but in the interest of time, thank you so much, Linda, for responding to those questions. In the interest of time and to allow enough time for the other presenters, I'll switch it over to my colleague Shannon to discuss provider improper payment investigations and recovery. However, with the chat questions, we will be getting a response back out to you guys who did not get your question answered, okay? So I will turn it over to you now, Shannon. Thank you.
Thank you, Janae. Okay, so provider investigation and recovery. First, let's define intentional, something that's done on purpose and deliberate. The caveat here is to prove that the actions were intentional. The activities most likely to encounter are falsifying invoices, such as billing for services on days the provider was closed, or billing for full-time care when the child routinely attends part-time, double dipping, billing and receiving payment for services that were paid by another funding source, or double enrollments with staggered hours that don't reflect the actual services rendered, altering documentation, modifying sign-in and sign-up sheets that do not accurately reflect the child's actual attendance, or adjusting verification documents such as proof of residency, homelessness verification, or any other documentation your lead agency may require to determine accurate eligibility. Here we have a few more examples: credentialing and licensing schemes. Shadow owner is a term used to describe transferring ownership of a child's care to avoid a CCDF sanction. Collusion. In addition to what is listed on the slide, there are a few other common schemes for this category, such as provider falsifying participant employment at a center. This is where those open communication channels between licensing and eligibility could really assist in fraud prevention. Provider allowing the parent to check in for days the provider and parent both know the child was not in care to lower the parent's co-payment obligation. And falsifying a child's age or type of services rendered to receive higher CCDF payments. There are many variations of other fraudulent activities. The key is knowing the type of fraud likely to be encountered within your program. This can assist the lead agency's efforts in preventing the fraud from occurring by taking action, such as updating training manuals and materials, reviewing, revising internal controls, and keeping staff informed of the trends. Unintentional program violation examples. Unintentional is an inadvertent act, a mistake made by overlooking or misunderstanding a requirement. Not to diminish these actions nor the impact on the CCDF program, but we are all human and make mistakes. How many times have many of us have had hectic work days and just don't allow us to get to some of the required routine administrative tasks such as reporting? We either rush through it because it's second nature to us, causing us to make mistakes or overlooking items, or we just simply misunderstood the requirements. Here are some common examples of unintentional program violations. Untimely disenrollment practices accompanied by routine submission of attendance. That leads to receiving payment for services not rendered. Failing to update school-age enrollments at the end of the summer going into the school year. Not having sign-in and sign-out sheets on file. And missing or overlooking reporting requirements. We understand not every program is set up the same. Some programs already have an established fraud investigation unit. Others may have interagency agreements with another agency's fraud investigation unit. And some have contracts with their local law enforcement to conduct or assist with the investigations. So pocket aces is often referred to as the best starting hand possible in poker. I like to think of the ace strategy as providing everyone involved with the investigation process with a solid foundation to build upon. And that's assess the facts objectively, create and implement a plan, and evaluate the evidence. Assessing the facts objectively. What do you know or don't know that would help prove or disprove the case? Do you know the who's, what's, when's, how's, and why's? Is this a trend? These are all good questions to help you organize your investigation. Create and implement a plan to prove or disprove the violation by familiarizing yourself with relevant policies and regulations that are pertinent to the time period of your investigation. Just wanted to point that out. Identifying a list of people to interview. Determining resource and access requirements to allow you to conduct the investigation. And lastly, ensuring a well laid out timeline that takes into account any statutory requirements and or limitations. Evaluating the evidence objectively, that is the key component here, to simply evaluate the established facts and determine if they are sufficient to support the case. There are a couple of strategies here. One is where the lead agency collaborates with the provider directly and determines an appropriate repayment approach. And the other is when the lead agency works with their legal counsel. These approaches may vary by each lead agency, and some lead agencies may use the strategies as a tiered approach, perhaps first trying to work with the provider directly, and if unsuccessful, then deferring to the legal counsel as backup, whereas others may only employ one of these strategies because it's what works best for their lead agency or maybe just more cost-effective. Another item I'd like to note, as we discussed in some of the prior slides, is that some lead agencies set a minimum collection threshold based on a cost-benefit analysis, while others enforce all collections, irregardless of the types. Communicating results. Here we have another acronym, CSI, Caseload, Savings, and Integrity, each with examples on the type of data to collect that can provide invaluable insights about your program and results to include in your CCDF plans or leadership. Lead agencies should also consider conducting comparative analysis month to month, year over year, to track linear progress and trends. With data, the possibilities of it are endless. One can have a lot of fun with this process depending on your personality type. And so, investigation and recovery benefits. Lead agencies are strongly encouraged to capitalize on their administrative data, as it provides critical program insights to data trends, needed policy changes, training needs, staffing requirements, and most important, it maximizes program dollars for their intended use. This practice also informs your administration and legislature of positive impact of program integrity efforts. It instills confidence in the general public that their tax dollars are being protected, and provides OCC with the crucial data to improve program operations nationwide. And with that, I thank you for your time, and we have a few questions. What are your program's most common provider intentional program violations, fraud, and unintentional program violations? And the second question, does your program have best practices for conducting provider investigations and recovery of funds? We'd love for you to share on one or preferably both of those questions, so we'll give it a couple of minutes for everybody to respond. I see 3 people typing, yes. Providers claiming children who did not attend, from Kim Miller. And Alicia Wells says, not reporting second parent in home, therefore underreporting parent income. Aubrey Hunt, billing for children who are not attending and failing to submit final charges. Thank you for sharing those. We have a few more people typing. Do we have any, oh, we have somebody typing in the best practices. I was just going to say, I know I'm getting greedy. I want both boxes to populate. Okay, so Philip Smith's billing for children and non-attending the center. And Eric Post, most common provider IPV, claiming children who are no longer attending. Most common client IPV, not reporting second parent in home. And Kim Miller on best practices is evaluate attendance against the report showing perfect attendance and all absent. And I think in the interest of time, Leanne or Janae, I'll defer to you if we can take a few more comments or if we need to move on.
This is Leanne. I think it's okay to let folks finish typing, and then we'll go ahead and move on.
Okay, cool. Perfect. So I'll read off a few more. So Rachel Mackin on the best practices, working closely with our child care licensing unit. Yeah, that's a good one too. And then Then Appling in Georgia, they attempt to recover all improper payments except for those resulting from agency error. For cases involving potential fraudulent activity, we refer those cases to our State Attorney General's office for evaluation. Tamara Schmidt, providers incorrectly billing for attendance, and Melissa Williams, providers billing full day when kids are only there a couple of hours part day. And M. Hood, billing for children no longer attending, failure to submit income or info for other parents. Thank you for sharing. I appreciate that. And then in the best practices, Eric Post said, agree with Rachel on working closely with licensing. That is a key to our success too. Also with counterparts in child and adult care food program. Good point, if applicable. And last one in best practices is Aubrey Hunt, coordination with CCR&R for assistance with business practices when potential UPVs are observed. That's great. I really appreciate everybody engaging in these chat boxes, and it's really helpful to your peers when we share, because it creates a better awareness. Thank you so much. And with that, I think I'll hand it over to Mike McKenzie.
Thank you, Shannon, and thanks to all of you for joining us today. I see we've got over 280 participants today, so a great turnout when you've got all this other stuff going on. We really appreciate it. So Shannon discussed IPVs and UPVs as they relate to providers and discussed some strategies for identifying and recovering improper payments resulting from those type of activities. Now I want to focus on how similar errors can occur from some CCDF family participants and how to deal with that. Some of this may be a little redundant, but each type of improper payment really determines what your actions will be. So as Shannon mentioned earlier, fraud is an intentional act done on purpose and deliberate. The key here is that you have to prove that the action was intentional. So the activities most likely encountered for participant IPVs include falsifying applications to exclude income or household members oftentimes. Again, double dipping like provider fraud, but a little different variation on this. This is receiving benefits in more than one state at a time. More likely to occur, of course, in folks that reside close to the border. Altering documentation, whether it's pay stubs, birth certificates, or other documents that could end up resulting in fraud. And collusion, again, splitting subsidy payments with the provider in lieu of a child receiving care. So really, as Shannon mentioned, so what you do to prevent these types of fraudulent activities before they occur is really important. And keep your staff informed of any trends you've identified. Help them out as well. Unintentional program violations. So you may find out during the course of investigation that there is an error in your case, but it was not intentional. Examples can include failure to report income ending. Sometimes it's fraudulent, sometimes it's not, or it's tough to prove. Moving out of state. Sometimes reporting to your CCDF agency that you're moving is the last thing on someone's mind as they're packing up and getting out of the state. And changes in household composition again. Sometimes this is just somebody forgetting to make that report. And the key here is to mitigate the error as soon as you can. So going forward, correct the case and make sure that benefits are correct from that point forward. Determine if there was an improper payment and whether you need to establish a claim for it. If there is an improper payment, then use your agency's process for collection. We'll talk a little bit more about that. There's various ways to collect improper payments. And again, you may also want to educate the participant on the error so that it doesn't happen again. Similar to provider error, there are a variety of investigation strategies to employ to help you determine if fraud has occurred and whether it resulted in an improper payment. Sometimes these are strategies within your eligibility system. Sometimes they are strategies that you have to do outside of the eligibility system. We want to look at a few of these strategies over the next few slides. Let's look at some options for red flag reports. I won't go through all of these, but I want to highlight a few. The new and inactive provider report. This can detail providers new to the system and providers no longer participating so that appropriate actions can be taken with the children enrolled or seeking to enroll with this provider. A payment threshold report is a systematic report that flags certain providers whose payments exceed anticipated billings. This may warrant further review of billing practices based on these reports. Again, it doesn't mean an error or that fraud has necessarily occurred, but it's something to look at in terms of a possible error that could result in an improper payment. A duplicate payment report identifies payments that have been issued to a provider on behalf of the same child for a service month. And the underutilization report indicates children who are not attending at the authorized level. Again, it doesn't necessarily indicate fraud, but you probably want to make contact to determine if services are still needed or a change in the level of services is warranted. Then I just want to take a minute and review a few strategies that some lead agencies have used to proactively identify errors through supervisory or quality assurance reviews. In one lead agency, an error trends report is distributed to program managers and reviewed by all eligibility supervisors on a monthly basis. Another agency has monthly meetings to discuss trends in errors, policies, and procedures. And then finally, we talked a little bit about the error rate review process before. Many agencies complete quality assurance reviews every year, even when the state is not on the cycle for their federal review. You've got the process set up already, and so we would encourage you to keep up on that process and use it to identify potential errors ongoing. And then here's a couple of investigation strategies that some lead agencies have used related to IPVs. In one case, program policy staff review IPVs submitted for other economic support programs like SNAP or TANF to verify if the individual suspected of the IPV was receiving child care benefits as well, and if the IPV is also applicable to the child care program. In another case, the lead agency's Office of Inspector General investigates fraud and intentional program violations. The recovery of funds associated with fraud or IPVs is a joint effort in this case between the lead agency's CCDF program, their fiscal and legal staff, in coordination with the state's Attorney General's office. In terms of recovery strategies, again, Shannon talked about this a little bit before. Some agencies set a minimum collections threshold based on a cost-benefit analysis, while others enforce all collections. As Shannon mentioned, you also have legal remedies you can consider for participant improper payments as well. Some of those include lien or levy on property, wage garnishments, and tax intercept. These recovery strategies may likely require some language in your state law to support that activity, but that's what the regional office is there to help you for. So if you have questions on possibly looking at legal remedies for improper payment collection, please reach out to your regional office, and they'll see if they can connect you with some states that have already taken these actions to see if they can help you out in a peer-to-peer call. All right, recovery considerations. We talked about this a little bit already, but you know, you might want to think about a minimum threshold for recovery. Sometimes it may not be cost effective to pursue collections. You know, for instance, does it cost you $300 to collect a $100 overpayment? So you can set thresholds. Many states do set a threshold anywhere from $1 to $500. We've even seen up to $1,000 in terms of a threshold. The other piece of this to think about is who does your collections? Do you collect it through your own agency, or do you contract with a separate entity, either another agency within your state or territory or tribe, or possibly even a private entity? Regardless of who it is, we would suggest you consider having an expert do your collections. Tap somebody to do it and do it regularly so they establish a good process for it. If you contract with somebody, make sure they provide you the data on results that you want to report to OCC anyway. And to do this, you want to make sure that it's included in any agreement or contract you have with this agency. Janae, we wanted to do a quick poll here on thresholds.
You ready?
Yes, ma'am.
Right, here it comes.
So we're just curious here, folks, about any thresholds that your agencies have set in terms of collecting improper payments. We've got a poll off to the side here. Janae, do I need to pull? There it is. Thank you. So we're wondering, what is your agency's threshold for attempting to recover non-fraud improper payments? And go ahead and take a minute or two and fill out the poll for us. You can see you've got 0 to 99, 100 to 249, 250 to 499, and then 500 and above. So we're just curious as to what agencies are doing. We saw a lot of responses to state plan requests for this piece and indicated quite a few agencies have set a threshold. So certainly right now, if you're looking at the poll, you can see that 0 to 99 leads the race pretty significantly. 75% of the agencies responding right now indicate that they have anywhere from 0 to 99. So we're going to give you about 30 more seconds, and then we'll wrap up this poll. But clearly up over 75% for 0 to 99 right now. 49 responding agencies indicate they have 0 to 99. 22%, or about 14 agencies right now, indicate 100 to 249. And then we have 2 agencies today that have indicated they have a threshold over 250. So that gives you an idea of what states are doing with these thresholds. I want to thank you for your response. We'll end the poll at this time. All right, we're going to change it up a little bit and just talk about communicating results. And wanted to give you an example here from one state that utilizes the Paris match. It's a payment accuracy review information system. This is an interstate match that can provide you information on states that are or individuals receiving benefits in more than one state at a time. In this case, it's the information's a little bit dated, but I think it's a good example of communicating results. So this lead agency indicated from Q2 in 2017 through Q1 in 2018, 144 matches were received from the Paris report. Of those 144 matches, the lead agency received 91 responses from other states, resulting in 10 referrals for fraud investigation. Again, it may not necessarily be fraud, but as we've talked about earlier, it could be a case where somebody moved out of state and forgot to report it to the state. So this is another way to make sure that the right benefits are going to the right people in your agency. And then just a few other examples of communicating results, just something to think about. You've got a lot of data, and it's just a matter of knowing where it is, how to get it, and when to get it. So here's some good examples of results that you can communicate related to your program integrity efforts. Claims established, including the amount of claims, whether it was the result of IPVs or UPVs or agency error. Improper payments recovered, and you can include how it was collected, the method that was used from the different methods. Number of intentional program violations, that's a relatively easy one for states to keep track of. So number of IPVs referred and those established after adjudication. Finally, the savings estimates. This is the idea of looking at your overall program savings, maybe incorporating savings from IPVs, from overpayments established, and any future savings that you're preventing improper benefits from going out. So just some ideas for communicating results. And we've talked already a couple times about the benefits of catching this stuff up front. So I'm going to take a little bit of a different take on this and just suggest that it's much easier from a workload perspective to provide accurate benefits up front. So I want you to think about all of the work associated with identifying and correcting an improper payment. You've got the investigation, calculating and establishing a claim, possible appeal of the claim, pursuing an IPV if that's applicable, and then collecting the improper payment. So save your agency time and gain the public's trust by ensuring the right benefits are going to the right person at application and redetermination. Case accuracy and timely actions on improper payments when they do occur can act as a deterrent to others that may be considering fraudulent activities in the future. All right, just a couple of discussion items here. We're interested in hearing about any participant fraud cases you might want to share with us, particularly how much was the improper payment, and how did you find it in the first place? And then the other question we have for you today is, what is the one tool you wish that you had to prevent participant fraud that you probably don't have right now? So we'll give you just a couple of minutes to type in a few responses. Alicia indicates her agency would like the wage match. We've got a couple examples of participant fraud cases. Duplication of checks. That's an interesting one, Yvonne. T told us about failure to disclose the absent parent in the household, pretty common fraudulent activity. A couple other people have talked about that too. Both Ambra and Eric talk about someone forgetting to mention others in the household. And Kim, I believe you're from North Carolina, talking about a state supervised county administered program which has its own issues. And you indicate counties have responsibility to investigate, and we have some counties that do front-end evaluation on all one-parent cases to evaluate the status of the absent parent. And Bruce indicated there are data analysis services for welfare fraud. We've looked into one specifically for child care. Good luck with that. Hope that works out for you. Yvonne would like a reliable administrative assistant. And Ambra mentions any linking of child care to other programs. So we have more checks and balances. Phyllis, I'm glad to see you're using the Paris match as a tool. I think it can be an excellent resource even for child care. And Ben mentions many cases of fake pay stubs and other parents in the household. Thanks for that, Ben. Congratulations on the Braves winning the World Series. And I think with that, we're going to wrap this up. Thank you, folks, for lots of good posts here. Really appreciate it. Leanne, was there a question that you wanted to address that was in the chat box, or are we good?
I think for now we should keep moving, but if we have time at the end to address some questions, we definitely will.
Sounds good, folks. And if we did not get to your question today, we will certainly follow up and make sure we get back to you after the webinar. So thank you for your time. Thank you for the great work that you all do, helping many families across the nation. Really appreciate it. And with that, I'm going to turn it back over to Janae.
All right. Thanks, Mike. All right. So now let's just switch gears here a little bit and talk about, discuss administrative and agency improper payment investigations and recovery. On your screen, we've divided improper payments from an agency standpoint into two types, right? So we have agency fraud and agency errors. In each of the text boxes on your screen, we have added examples of each and to show what these terms may equate to or correlate with when it comes to an activity. Now, full disclaimer here, lead agencies have flexibility in defining these terms and activities. But generally speaking, fraud is usually determined by a judicial or other adjudicative system. So let's look at some examples of agency errors. Some of these we may have talked about early on. So basically in the agency error, we're talking about a failure to correct or complete an accurate administrative record that may cause an improper payment. So this could be incorrect authorizations or household income calculated incorrectly, or skipping steps in the procurement process that cost the agency money, and the agency ends up paying more than the allowable cost. So what are some steps to investigate and recover agency errors? So obviously there's the case reviews, investigations utilizing case reviews or supervisory reviews or quality reviews, fiscal reviews or contract reviews. Generally speaking, any review of staff activities can be used as part of an investigation. However, consistency in reviews is important to improper payment investigation. Consistency is maintained through appropriate oversight and accountability strategies, which ensures that the agency avoids bias investigation activities and displays a commitment to the program integrity to all staff. Now, since we know that the recovery of agency errors improper payment is optional, one thing that Mike discussed earlier was setting a minimum dollar amount. So this is one option that agencies could utilize if should they choose to recover administrative or agency error improper payments. And remembering that it was the agency's error, so it would be in the best interest that parents and providers are provided reasonable accommodations when needing to repay such funds. All right, so now let's talk a little bit here about agency fraud and some agency fraud examples. So on your screen, these are some agency fraud examples, both internal and external, that may cause an improper payment. So we have creating fictitious providers and participants for personal gain, taking and giving bribes for contracts, contractors and vendors inflating costs of labor and supplies, contractors and vendors knowingly billing the government for services not provided. So these are just a few examples of what the agency or administrative fraud could look like. So let's talk about how will we investigate and recover some of those monies. So here are some strategies for investigation and recovery. From an investigation standpoint, agencies could consider conducting internal random desk audits, right? Looking at the staff processes. You can do that either internally or contracting out to a third party to monitor or conduct those audits of program and fiscal operations. Collaborating with other state agencies like local law enforcement, Federal Bureau of Investigation, or state legislative auditors. And of course, recovery in cases of fraud is required, and in those cases, you would use some of the options provided by my colleagues earlier, and to include these other additional options such as State Department of Revenue Services or criminal courts and restitution. All right, so what about the results and communicating those results? So on your screen, we have two examples of communicating results. There's the investigation example and the recovery example. I won't go through both of these and read them off. When you guys have time, do, sit down, review them, and if you feel that you need assistance in developing or outlining some ways to communicate those results, definitely reach out to the regional office. We are here to help and provide assistance. All right, so let's talk about the benefits of conducting investigations. So some of those benefits include conducting investigation. Some of those benefits, include it assists in determining administrative error patterns, right? So you can gain, and also you can gain an understanding of internal and external administrative risk activities. It also allows you to proactively mitigate administrative risk activities while identifying and improving documentation and procedure errors to reduce improper payments in the future. And here are a few recovery benefits, which includes when you recover those improper payments, it allows for you to repurpose those CCDF funds, something that Linda from OCC mentioned a bit earlier. It also may increase program administrative resources, such as creating program integrity trainings or improving management and administrative implementation of processes for implementing fraud prevention and identification and detection strategies. And as always, you build trust with the public, and it allows for you to serve more children. All right, so let's talk about it here before I turn it over to our state presenter. I have two questions in the chat box for you guys. So one, does your agency recover improper payments due to agency error? And if so, describe. And again, the other lead agents are looking to each other, right? They're wanting to see what their peers are doing. And the second question here is, does your agency investigate improper payments due to fraud? And if so, and we're talking about agency fraud, if so, describe. Is there a process in place to investigate improper payments due to agency fraud? Let me re-say that. I might have mixed that up a little bit. So we're looking at agency error for one and agency fraud for the other. You guys care to elaborate a little bit and tell us exactly, maybe give a short little synopsis of what that looks like for your agency improper payment recovery? All right, Kim Miller say we evaluate the counties and they must pay back the funds for administrative errors in eligibility decisions. Wow, so the counties are responsible for returning that money to the lead agency. Is there a requirement for those counties to receive those payments from participants or providers, Kim? Matt says Washington does, but we're in the process of ending the practice. Do you care to elaborate, Matt, on why you guys decided to end that practice of recovering improper payments due to agency error? And how about for the second question, does your agency investigate improper payments due to agency fraud? Are there any investigations going on for, looks like Cheryl said, I would say yes, we would do an internal investigation if we were made aware of the agency fraud. So if you received maybe a tip, I would have said that you would actually do an internal investigation. Correct, Cheryl? All right. So I'll give you guys a few more minutes to kind of respond to my questions and type in the chat box, and we're going to get ready to turn it over to our state presenter, Melissa Vo. Amber said, yes, however, I have not seen this. Lucky you, Amber. Great. That's actually great, though. I'm being facetious. All right. And Phyllis says, Illinois does recover improper payments by means of audit reviews conducted. This includes IPV and UPV. Tamara says, yes, the investigation is conducted by our internal audit division. All right, so I'm going to let you guys finish typing in the chat box here, and without further ado, thank you for your time and thank you for your participation. But without further ado, I would like to present to you guys and introduce Melissa Vo. She is the TANF and CCDF Child Care Program Integrity Manager at Kansas Department of Children and Families. Melissa, the floor is yours.
Thank you, Janae. Good afternoon. Again, my name is Melissa Vo. I'm the TANF and Child Care Program Integrity Manager with the Kansas Department for Children and Families. I oversee the policy and quality assurance for, of course, the TANF program and the Child Care program. I also manage the Child Care Provider Integrity Education and Support Unit. What we'll do today, I'll basically go through briefly what the unit does as far as how we investigate, audit, educate providers and recipients. A lot of the information you had probably already seen in the previous with the previous presenters. The Child Care Provider Integrity Education and Support Unit, short we call it PIES, the PIES unit. We're a specialized unit with DCF created solely for the child care assistance, which is obviously a federally funded program. We review both child care providers and the recipients. The unit monitors compliance, identifies and processes improper payments. We investigate, we detect, we prevent child care fraud for both provider and recipients by education. We also investigate and prosecute through either criminal, civil, or administrative disqualification hearings when fraud is discovered. Like I mentioned a little bit ago, we audit and educate both the recipients and the providers when we go out and do the audits and we review their cases. We support both recipients and providers by fielding questions, attending meetings at the health department, giving out our contact information, our information as far as the policies and procedures of becoming a DCF recipient or daycare provider. As far as audits, again, we do, I'm so sorry, we do audits for daycare providers. So basically, we get a selection of DCF childcare providers or recipients for audits. They're based on a list compiled by various factors we call red flags. And during this audit, we review both the provider information and also the recipient files. We review all the files for all children care. And we look for any information that contradicts anything that they provided, DCF versus the daycare provider versus any employment information that we might possibly also have on file. And all these audits are basically unannounced. So once we get the red flag and we determine who we're going to audit, we basically just show up to the provider's house, get all the files, and start our audit and review of everyone's files and documentation. I believe Mike probably talked about red flags earlier. Basically the same thing. When we get our red flags or outliers reports, they consist of things such as excess child care payments, duplicate child care payments. We receive dollar amount of child care assistance payments from providers who receive semi-yearly. So for instance, if a home provider had received over $100,000 in the last 6 months, I mean, that's obviously a gigantic red flag. We also receive internal, external reports from outside agencies as far as from other departments within DCF, other workers. We also have the fraud hotline, which is basically connected to a separate fraud unit, and they consist of, they basically do combined investigations, and they look at primarily food assistance, TANF, and when it's childcare, then that's when we collaborate with the fraud unit, because like I mentioned at the beginning, our unit, the child care PI unit, we specialize in child care only, recipients and providers. So when there's a combined fraud, that also includes any type of food assistance or TANF, that fraud unit brings us in, so that way we're able to help them out in looking at documentations and records from the providers, going out and doing the special audit. As far as investigating, when we find child care fraud, when we identify child care fraud, we assess factors and circumstances, and we also look at these indicators for the providers and both the recipients, EBT card numbers, PIN numbers, timesheets, any type of, again, contradicting the information that either one of them might have that had reported something differently to DCF or the provider or the recipient. These indicators are something that we use as far as what we look for to kind of give us a heads up, but these indicators don't always mean that there is a fraud or there is an error. So that's why we go through and basically start our investigation or our audit on both of the provider and the recipient. As far as going through and investigating, we of course do a preliminary assessment, which I briefly explained. We complete the detailed, thorough review of both the recipients and the provider schedules, attendance, staff. We look at capacity, hours of operation, payments. We basically look at everything to identify any non-compliance or violations of policy or misrepresentation, or again, any contradiction of any information that might maybe result in any type of payment errors or fraud. With our audits, we give corrective actions when we have an audit as basically a first warning, and here is your education part. For daycare providers, we notify them in writing, providing them with a detailed description of any type of noncompliance or errors. educating them on our policies, our regulations. For the corrective action, daycare providers are required to attend an online subsidy training course. This is a training course that all daycare providers are required to take at the beginning when they sign up to become a daycare provider. But in the event of any non-compliance, we also have them retake the course. There is no limit to how many times they have to retake it. It's just a part of the education, and the course basically goes through all of the DCF policies and requirements in being a daycare, DCF daycare provider. When we give them a corrective action, we of course go out and do another follow-up in about 3 to 6 months to make sure whether or not they're non-compliant. Now, if fraud is found, however, if there's any indication of fraud, we will still do the corrective action, but the investigation will begin after we send the corrective action to the provider, because this will allow our team to further identify any potential areas of fraud or patterns of the fraud, and at the follow-up, we'll be able to obtain any up-to-date evidence demonstrating their intent to fraud. As far as the, as far as the recipients are concerned, we basically do the same thing. However, recipients do not have a corrective action. There's no corrective action for recipients. When we find discrepancy, we notify the eligibility staff and they process or update any of the changes. When we audit the recipient's cases, their files, we generally discover any information, that we find that the recipient either failed to report accurately or omitted when they initially applied. And then if need be, we would request additional information. But again, there is no corrective action. It's just reported to eligibility staff for them to update the case. And then we start the fraud right after we report it to the eligibility staff. And then we begin the investigation and obtain any other additional information needed to demonstrate the recipient's intent to fraud. If fraud is identified after reviewing all the information, and if there is an indication that the DCF provider or child care recipient has shown intent to fraud and they've received, obtained, or attempted to get the child care assistance payments that they're not entitled to, that's when we start the preliminary assessment. And we complete a detailed and thorough investigation to build a case, gathering all of the information, subpoenaing or obtaining any evidence, information, documentations from any outside agency, employers, schools, what have you, depending on what the fraud could possibly be. So that way we would be able to obtain enough supporting evidence to prove the intent. Obviously, if we're not able to obtain enough evidence to prove the fraud, then we're not able to take the case to fraud to be able to proceed any legal proceedings. So as far as the evidence required, So as far as the evidence required for recipients, they are able to have an administrative disqualification through DCF. Daycare providers cannot because with the state of Kansas, we issue the child care payment to the parents and the parents pay the daycare provider. So there's no way for us to be able to actually do an administrative disqualification on the daycare provider because they sign an agreement at the beginning when they sign up to become a DCF provider to accept the payments from the parents to care for their children. For civil case, we could take both parents and providers to the civil case, to a civil court. The threshold for civil cases is, I believe, $2,500 for recipients and $5,000 for daycare providers. We were looking at possibly increasing it, But the state of Kansas, we have a shortage in attorneys right now at DCF to be able to take any daycare providers or recipients to civil or criminal court. So we have not been able to do that for a couple of years now. As far as the criminal case, the threshold for that in looking at a criminal case for either a daycare provider or a recipient would be about $50,000, but obviously we would have to work with a DA for them to be able to determine whether or not they want to take the case. Again, because of the fact that the state of Kansas is lacking attorneys with DCF, we're currently unable to take any recipients or providers to criminal court as well. As far as the sanctions due to program violations, like I previously mentioned, for an audit, there's a corrective action plan. For daycare providers, for the recipients, there is no corrective action plan. For fraud, for daycare providers, DCF does not disqualify providers, but has the right to choose which provider they will do business with, sign an agreement with. And the state usually does not do business with providers or sign an agreement who've been convicted of fraud. However, depending on the circumstances, depending on whether or not we've recovered all of the improper payments, then there is a possibility of us signing another agreement. But that's something that we would basically meet up with the staff and administration to determine whether or not we're going to sign an agreement with them again. All unintentional and intentional payments errors are set up for recovery. As far as daycare recipients, there is, again, like I said, no corrective action plan for the recipient. For fraud, if a recipient is found to have committed a program violation, they will render themselves and all included adult members ineligible for their lifetime. Children, of course, remain eligible for child care. So the parents, the recipients, will just have to meet all of the qualifications for eligibility for child care, and then the children will still be able to obtain the child care benefits, even though the parent has committed fraud. Parents who are also who've been determined to have committed fraud are ineligible for cash assistance or TANF. Lifetime ineligibility is applied to both programs for recipients, even if fraud is only committed in one. Again, both unintentional and intentional payment errors are set up for recovery. As far as improper payment and recovery is concerned, once an improper payment error is discovered, the PIES unit will calculate the overpayment error based on the type of error. So they have the improper payment error, the unintentional payment error, and intentional payment error. So it would either be just a regular client or vendor overpayment for the improper, meaning, they forgot to report something, or if it's not intentional. The unintentional error, non-fraud payment, intentional payment error, fraud overpayment. As far as recovery is concerned, we do have a unit called the Central Collections Unit. Once we create the overpayment claim and send out the notice to notify the recipient or the daycare provider that, hey, you have an overpayment, we allow them 10 days to send back a notice providing us with what type of, how they want to pay back their improper payment. So for child care recipients on an unintentional payment error, they are actually able to, for recipients, they're actually able to request that we just recover their overages in their existing daycare benefits if they're active, if they have an active case open. So it's 10% for unintentional payment errors for recipients. As far as fraud, They again also have that option, but we would recover 20% of their benefits if they're eligible for child care assistance again. And then once they sign the agreement, and I forgot to mention, the agreement also allows them to either pay by check, a monthly fee, or again, recovery. We would send it to Central Collections Unit, which is a specialized unit that basically deals with recovery in the state of Kansas. And then they will basically get deal with the recovery and send out the notices and ensure that the payment is actually made. And I think I accidentally skipped oh, maybe I didn't. I thought I skipped. So for daycare providers, the system's still the same as far as the repayment agreement. However, yeah, and I think there is a slide missing. So for daycare providers, there is no agreement for them to do recovery because, as again, I said it was the parents pay them. So the only option they have is to either have a monthly payment set up, or they have to pay it all at the same time with the check, or they will just have to wait for the state to recover it through the taxes, which now we're on this slide. I'm so sorry. So as far as Central Collections, the majority of the daycare providers who have any type of overpayment or overages, we send to the Central Collections Unit because a lot of them just decide to either not pay or request that they are set up with some type of payment plan. So as far as the Central Collections Unit, what they'll do is they will monitor the improper payment claim and recovery, and then they manage the claims and balances. So all of the child care provider debts and all the debts except food assistance in the state of Kansas are taken out of state taxes. All the child care debts in the state of Kansas are put into the Kansas debt recovery system. And Kansas has chosen to use the federal treasury offset program, only for food assistance overpayments. So, and again, this is something that Central Collections Unit does. Once we have the overage or the improper payment set into active, and we hand it over to Central Collections for them to do the recovery. Now, these are just some slides as far as the fiscal years. Again, there's going to be a huge difference between 2018 and 2021, primarily for the reason of us not having attorneys. So in the fiscal year 2018, as you can see, the red is how much we discovered in the improper payments. We have the fraud, which is over 190,000, client error, 361,000, agency error, over 21,000. So in the fiscal year of 2018, improper payments found was $574,501 in the state of Kansas. As far as recovery, that is in the green. So for the fiscal year 2018, as of current, we've recovered from that time period over $226,000 for the fiscal year of 2018. For 2021, the numbers have drastically decreased. So with us not having attorneys, a lot of our potential fraud for daycare providers, we've turned them into vendor or client errors. So that is why the client error amount is higher than it is for the fraud. It's because we don't have any attorneys to take the daycare providers to court. For the little amount of what we have for the fraud, the recipients are actually able to sign a fraud waiver saying, hey, I committed this, and then again, administrative disqualification, and then we would still be able to get a judgment on them. But yeah, as far as daycare providers, the majority of the amount that we've recovered that we've discovered, for daycare providers, and their fraud is lumped under the client vendor area of the 194,000 because of the fact that we have not been able to actually take them to court for an official judgment for fraud. Again, drastic decrease. The total amount of improper payments for the year 2021 or fiscal year is over 213,000, and we've recovered almost a little bit over half of that amount for the fiscal year for the state of Kansas. And this slide here will show up side by side as far as the amount. The purple is 2018, how much the errors were in the first lump, the fraud client agency error. The second is how much was recovered in the second grouping. And then the last is the total recovered for that fiscal year. So the purple is 2018 and the teal color is 2021. Again, drastic decrease, but almost half of the amount. But that's primarily because of us not having an attorney available to actually take a provider to judgment. And the slide here will just, again, show the overall cases reviewed, audited, educated for the fiscal year of 2018, purple. 2021 is the teal. In 2018, 694 cases were reviewed. And in 2021, 377 cases were reviewed for fraud. And I'm so sorry that I ran through that. Does anyone have any questions?
Thank you for that, Melissa. Looks like we do have someone type in the chat box. Let's see what we have here. Tamara asks, how many staff do you have in the unit?
So the unit is 3 staff members for all of state of Kansas. So we have 1 staff person that covers the Wichita and West region. We have 1 staff that covers all of the East region, and then we have 1 that covers all of the Kansas City region. I've been trying to get another staff person or 2, but yeah, it's just the three of them right now for the Provider Integrity Education Support Unit.
Thank you. And we have another individual type in, Ruben. We'll give him just a second. And Tamara's replying as well. She says, thank you.
You're welcome.
Let's see here. I'm sorry. Give him a few more minutes. All right. Sandra says, how many providers do you have statewide?
We have, I will have to get back with you on that one. I believe it's in, I don't want to just throw a number out there, but I can get back with you on that. My contact information is actually the last part of the slide. So if you want to send me an email, I can give you the specific number and then break it down if you want to know specifically how many we have where.
Perfect. Thank you so much for that, Melissa.
Mm-hmm.
Well, we have
And
a couple more.
I apologize for going through these slides. And I apologize for going through these slides so quickly, but if you have time later on, you can review it, or again, my contact information is right there if you'd like to contact me directly.
Perfect. Right, and we'll do that. So if there are any other additional questions, as Melissa indicated, there's our contact information. If there are questions that we did not get a chance to answer today in the chat box, we'll circle back and definitely get you those responses. I'd like to thank Melissa for taking the time out to come and speak and present with us today. It was definitely a pleasure and an honor having you here today, Melissa. With that,
Thank you
I
for
will
having
turn
me.
it over to Leanne. You're welcome. You're welcome. Thank you. I will turn it over to Leanne to close us out.
Thanks, Janae, and thanks so much, Melissa, for sharing your state strategies. And I particularly like seeing the results of your program integrity strategies and the amount that you were able to recoup. So thanks again for sharing all that information. Folks can jot down Melissa's contact info. As she said, you're welcome to reach out to her directly. I'm going to close out with an evaluation. It's going to pop up on your screen. We do really appreciate getting your feedback. We want to continue to improve. We want to continue to ensure that we are meeting your needs, and your feedback drives the content of future webinars. So as soon as that pops up, please take 2-3 minutes to complete that for us. Technical assistance is available at any time. Please reach out to your regional office, and they will connect you with us and get you some technical assistance if needed. And if you want to jot down and save the date, our next webinar is going to be March 22nd. So again, I'm going to switch over here to the evaluation. Please complete for us, if at all possible, if you have a couple minutes. Happy holidays to everybody. You're approaching the holiday season. I see so many familiar names, and yeah, I was going to say voices, but I guess technically that's not true. I see a lot of familiar names, and very thankful to have you all participating regularly on these webinars. So thank you for all you do. I'm going to close the audio. However, the room will remain open, so you can take some time to complete the evaluation. Thanks so much, and have a great night.